Good morning to one and all. Uh, Today's lecture topic is Principles of Tooth Preparation. I'm Dr. Priyanka. Let's look at the learning outcomes first. First one is to evaluate the abutment tooth. Okay, so there we are going to cover many more things and also the Anti's law. Second was the principles of tooth preparation, which is divided into biological, mechanical, and aesthetic. Finish lines, there are many finish lines. We'll talk about the indications and disadvantage, advantage of the same. We'll talk about retention and resistance form, and we'll talk about the factors affecting them. Coming to first few slides about evaluation of the abutment teeth. It's divided under a few categories. That is, first one is replacing a single missing teeth. So usually we understand that we need support mesially and distally because of the Anti's law to replace one teeth, right? So single tooth can be replaced basically by a 3 unit FPD, with an exception of mandibular or maxillary canine, which is ideally indicated that it gets splinted by both of the central incisors. Yeah, or you take a support even from the premolars. Coming to types of abutment teeth, so cantilever fixed dental prosthesis is one of them. FPD, which is supported only from one side of the pontic and attached to the retainer, is referred to a cantilevered pontic. Long-term prognosis is not so good; it's poor, and that's why it's not advisable most of the times. Cantilevers induces lateral forces on the supporting tissue, and which can be harmful and lead to tipping. I'll be showing you a photo in the next slide. Forces are better tolerated in a 3 unit FPD. There you go. Yeah. So this is a 3 unit FPD and forces are evenly distributed. Here, if you just give a cantilevered crown, there will be tipping and it can cause rotation and it can cause failure basically. Okay, coming to the assessment of abutment teeth, radiograph is the best way to assess. So you have to see the radiograph and the pulpal health. Okay, and of course, the pulpal health can be evaluated by the thermal or the electrical simulation. Coming to endodontically treated abutments, now the type of abutments that we are using, most commonly used is the endodontically treated abutment, where endodontics had been taken place, and most probably it is also post and core treated, right? And sometimes failure does occur when we have shorter roots, right? And that's why we have to reinforce the abutment teeth. Okay, coming to unrestored abutments. So this caries free and ideal abutment. These are the ideal abutments. Um, they are strong. They have strong retentive restorations with optimum aesthetics. Uh, Sorry, it can be prepared with strong retentive restoration with optimum aesthetics. The margin of the retainer can be placed without modification of the accommodation of the existing restoration. Or um, I'll be showing you this, sorry, later on. Okay, I do have a photo later in the slides. Okay, coming to most important topic here is the principles of tooth preparation, which is biologic, mechanical, and aesthetic. So basically, the biologic is conservation of the tooth structure, avoidance of over contouring, supragingival margin, harmonious occlusion, and protection from fracture. Mechanical has three principles: retention, resistance, and deformation, right? Aesthetic is we are basing our preparation so that there is less show of metal, maximum thickness of porcelain, subgingival margin, and the occlusal surface should be of porcelain. When you get everything in the middle, you have an optimum restoration. Coming to the biologic consideration, prevention here. Okay, so the important things are preventing damage to the to preparation. So adjacent teeth should not be harmed. Yes, the book says we can use matrix band. We don't have so much time for that, and actually, it's not required. If you do your burr angulation properly, we will not damage the teeth, and when we break the contact properly, we will not require that, right? Soft tissue is all about checking the gingiva, keep a check on the aspirator, the mouth mirror, and the saliva ejector. Use it properly. Retract the cheek, the tongue, and the gingiva properly, right? I mean, don't go over the gingiva. Yeah. Pulp, it should be protected. There are three degeneration that can take place, three types of injury. That is from heat, some certain chemical agents, and micro leakage. Has to be protected. Methods of conservation of the tooth structure. Other surrounding tooth structure can be conserved by, yes, the book does say we should use partial coverage crown rather than full coverage. However, we are still using a full coverage crown because of many, many shortcomings of the partial coverage. Restorations, preparations of teeth with a minimal practical convergence angle, which is tapered between the axial walls. So basically, a taper has to be provided, right? Okay. Preparation of occlusal surface so that the reduction follows the anatomic planes to give uniform thickness of the restoration. Axial surface, preparation of the axial surface so that maximum thickness of residual tooth structure surrounding the pulp is retained. Selection of the margin geometry. The margin has to be selected properly. And then there should be avoidance of unnecessary apical extension of the preparation where you don't want to give some gingival, don't give it, guys. Yeah. Okay. So just showing how you will conserve the tooth structures. That is how we break the margin. I've told you, right? And then we just break the ledge. We are not going to hamper the side teeth. Yeah, the adjacent teeth, right? That's exactly how, right? For the posterior, this for the premolar. So we are basically giving sufficient thickness. We are leaving sufficient thickness even for the pulp, right? And we are not touching the gingiva and we are not cutting the pulp. We're not touching the pulp. We also have sufficient occlusal space, right? So we're serving the tooth. Okay. So here we are giving a taper. So guys, that amount of taper is ideal. This is excessive, right? Right? And this is less. Whatever, if we do excessive or we too much, we're going to create severe undercuts and the path of insertion will not be one. Ideally, the path of insertion should be one. So that is the accurate amount of taper. That is 3 degree. That is 6 degree taper, right? Okay. For the interiors. Uh, Coming to the axial reduction, abutment teeth are associated with gingival inflammation which have excessive axial contours. So, because it is difficult to maintain the plaque control around the gingiva, tooth preparation must provide space for the development of good axial contours, right? So, this enables the junction between the restoration and the teeth to be smooth and free of any ledges or abrupt changes in any direction. All right. Okay, so that has to be done properly. Coming to margin placement, sorry. Two important margins we are going to talk about here is, sorry, the level of the margin, that the supra, that is above the gingiva, and sub, which is under the gingiva, right? So advantages of supra gingiva are it's easier to maintain and be clean. We do not do any soft tissue trauma here. Impressions are easier taken, and restoration can be easily evaluated. Right. Coming to the subgingival margins, there are certain cases where we give subgingival margins, which is dental caries, cervical erosion, and some certain restoration which extends subgingivally. Okay. Sometimes the proximal contact area extends in the gingival contour. There also it's recommended. Okay, to provide additional retention resistance form, which we'll be covering in the coming slides. There also you're supposed to give subgingival margins, right? Um, if you want to hide any of the metallic surface and you wanted the teeth to look like it's coming out of the arch, um, to give it a more natural appearance, again we're using subgingival margin. If there is any root sensitivity which cannot be controlled by conservative procedures, then you have to apply the dentin bonding agents, and there as well you have to give a subgingival margin, right? Modification of axial contour wherever is required, such as to provide an undercut to provide more retention. Even there, guys, you have to give this, okay? Sometimes the undercuts are favorable for us, right? Okay. So B is basically the subgingival margin. It is actually under the gingiva. The view is such that it looks equigingival. Here it is too supragingival, guys. So that's what happens when you have a supragingival margin, which is really not preferred, guys. Okay. Oh. Yes, it does carry advantages, but in many cases it doesn't work, guys. Yeah. In the ideal standard textbooks or the ideal world, yes, everyone suggests, I have told you that before, right? So we're sticking to an equigingival margin. Coming to the margin adaptation, the junction between the cemented restoration and the tooth is a potential site of recurrent caries. So, because of the dissolution of the luting agent in inherent roughness, um, it is better to always place the margin more accurately and have it adapted properly, right? So, a well designed margin is smooth and even, right? Which will help in preventing the tissue displacement. It will help in taking impressions, dye formation, waxing, and finishing, guys. It will last longer. So, rough, irregular step junctions are not advisable. Coming to the margin geometry, so basically, there are a few conservative techniques how you can evaluate the margin. So there should be ease of preparation without overextension of or unsupported enamel. It should be easily able to identify in an impression or a dye, a distinct boundary of which the wax pattern can be finished. There should be a sufficient bulk of material, guys, and it should be conservative enough. Yeah. Okay. Coming to advantage, disadvantage indications, I'll be covering some of the contraindications in the next slides. So feather edge, chisel edge, bevel, chamfer, shoulder. For now, for important for you is chamfer and shoulder, guys, right? That's the basic ones which we are basically using, guys, right? For metal, and this is for PFM and all ceramic, guys, right? So just understand that, guys. I'm not reading that. Okay. Feather edge, chisel, chamfer, bevel, sorry, shoulder, sloped shoulder. It's a little sloped. This is 90 degrees. This is sloped. Yeah. And G is beveled. You see that is the beveling. Okay. And edge is the feather edge. You can see the under electron microscope there. Okay. That is the beveled. That is the chamfer. That is the shoulder, guys. Okay. And sloped shoulder and shoulder with bevel. Okay. So that you know and understand, guys. Okay. Coming to the margin designs, which is exactly the geometry in a little bit more detail. Feather edge should be avoided as it does not provide the bulk anywhere at the margin. So basically contraindicated, guys. It'll chip off, your restoration will not stay, it will dislodge. Chisel edge margin should be avoided as forms excessive angle of taper, that is a convergence in which the orientation of the axial reduction is not correctly aligned. So that alignment and the orientation also is hampered, guys. Okay. Chamfer margin usually is for cast metal crowns and metal only portion of the metal ceramic crowns. Okay. It is distinct, easily identified, provides room for adequate bulk, and it is and can be developed by anatomical and the development of anatomically correct axial contours can take place, guys. Yeah, can be used. Beveled margin cast restoration is already show where the shoulder exists from the dental caries, erosion, or previous restorations, right? So these margins can be beveled. Beveling, there are three objectives, sorry, to allow the cast metal margins to be bent or furnished against the prepared teeth to minimize marginal discrepancy caused by the complete crown that fails to seat completely, to protect the unprepared tooth structure from chipping. Okay, so that is why we do beveling, guys. Okay. Uh, we will be talking about functional cusp beveling in the further slides. Coming to shoulder margins, that's the facial part of the metal ceramic 90 degree with unprepared tooth surface. It is preferred because of the setting and the biologic reasons. Heavy chamfer margins is easier to prepare with precision. Sloped is 120-degree, right? That goes to an obtuse angle, right? Okay. Reduced the possibility of leaving unsupported enamel, but leaves sufficient bulk to allow thinning of the metal framework, guys. So it is useful as it satisfies the biologic and the aesthetic criteria. Okay, bevel shoulder margin can be used in the facial surface of the metal ceramic restorations. Okay. Okay, guys. So functional cusp bevel, you can see that that is beveling done, is an integral part of the occlusion reduction, and the name of the bevel is the functional cusp bevel because we give it on the functional cusp. Okay, a wide bevel placed on the functional cusp at a degree of 45 angle provides space for an adequate bulk of material in that area to bear the heavy occlusion load. Okay, lack of functional cusp bevel may provide thinning or perforation of the crown, may result in over contouring and poor occlusion, and over inflation of the buccal surface, which will destroy excessive tooth structure, reducing retention. Okay, yeah. So there you can see insufficient beveling, and you can see beveling. Okay, right? Okay. Coming to the occlusal consideration, occlusal plane should be analyzed and reduced. Proper reduction should take place, hence diagnostic tooth preparation and waxing or wax up procedures should be done. Preventing tooth fractures, cuspal fractures can occur because of the parafunctional habits. Can reduce the chances of fracture with following tooth preparation principles. And just now, as we saw, said bell, right? Okay. Uh, when excessive taper is given, guys. Okay. Sorry, there. Excessive taper, right? More than required, it will lead to dislodging of the crown, right? It will lead to crown being placed in many different um, placements. Yeah, there will be no single path of placement. So this is just indicated, guys, right? Minimum clearance should be 1.5, and 1 mm marginal ridge and fossa should be reduced to 1 mm. Yeah. So that's what it's basically showing, guys. Okay, coming to the mechanical considerations, guys. There are three important ones: retention, resistance, and deformation, right here. Okay. So if we adhere to these principles, the crown restoration will not be dislodged, and there will be less chances of distorting or fracture of the restoration. Coming to first the retention form, um, there are certain forces. Example, the jaw is moving, biting, biting from the sticky forces, right? Sorry, sticky food. So it acts on the cemented crown in the same direction, and it can cause displacement, guys. Yeah. The quality of the preparation that prevents the restoration from becoming dislodged by such forces parallel to the path of placement is known as retention. Only dental caries and porcelain fracture outrank lack of retention as the cause of the failure of the crown. Okay, sorry. So now coming to the third one, that's the roughness of the fitting surface of the restoration. Um, the surface of the crown inside is always roughened, guys, right? So it has a proper adhesion, so it can sit properly. Material being cemented, the different cements which we are using, and also what type of the restoration is it? What type of the crown are we cementing is important. The film thickness of the luting agent should be proper. Okay, so you can see that here it's talking about the retention form, the nut and the bolt. It can only move in one direction, guys. It doesn't have 10-20 path of insertion and removal, right? That's how exactly we should have. If we have a proper taper, the crown will only be able to sit and dislodge in one path of insertion, right? That's exactly what it's showing. Here it's showing that if you have a full coverage crown, there will be a proper coverage and you will be able to take sufficient tooth structure. Here, these are partial coverage crowns, guys, which is not sufficient, but that's the path it is following, guys. Okay. Uh, Very important factors, again, like we discussed, the taper, the best is 6 degree, surface area should be sufficient, type of restoration should be basically full. Uh, Surface should be rough, right? Luting thickness should be an adhesive resin. Yeah, and then comes the GIC and then the rest. There are a few factors here, the three of them which are important. So magnitude and direction of dislodging forces. Resistance is function of the relationship between the axial wall taper and the prep diameter and the prep height. Okay, which has to be followed properly. Geometry of the tooth preparation has to be followed well, and so there will be no forces which are acting on the tooth surface. The physical properties of the luting agent should be proper, so it does not deform the restoration, right? Okay, and it doesn't cause too much uh, dislodgement of the restoration, guys. Okay, so here you can see a resistance form, guys. This is basically where the angle of rotation takes axis of rotation takes place. If you have it properly cemented in, you have a proper resistance form, guys. Here, proper taper, proper preparation, it will never be able to dislodge in the axis of rotation, right? So yeah, uh yeah, even if the lateral forces are being provided to the crown. Very important, the resistance factors of a cemented restoration can be dislodged by habits, right? The taper should be minimum or at least 6 degrees. The diameter, if you have a small one, you'll have higher resistance. Bigger will have lower resistance. So you should keep it sufficient, guys. Okay. Height, long, average, and short. Type of restoration, complete coverage is always advisable. Luting agent, adhesive resin is always advisable, right? Okay. So now coming to the last principle of the mechanical um, aspect, preventing deformation of the restoration. So alloy selection is important. Metal ceramic alloys with higher noble metal content have a good hardness, it should be used. Adequate tooth reduction should be there so that you can have sufficient bulk of the material to withstand the occlusal forces, right? This is the amount of reduction that we do in functional cusp, and there should be sufficient clearance. The margin design should be sufficient, and it should be away from the occlusal contact, right? And it should satisfy the requirements, guys. Okay, coming to the last principle, that is the aesthetic consideration, guys. Um, in all ceramic, the material thickness should be 1 to 1.5 for optimum aesthetics. There should be a heavy chamfer, or shoulder, which is at 90 degree. Metal ceramic, the facial reduction should be such, yeah, you all know all that. Partial coverage, proximal margin should be proper. Facial surface of the mandibular teeth should be chamfer, and maxillary should can be short bevel or chamfer, guys. Okay, just for the aesthetic requirements. Otherwise, we can actually follow the aesthetic principles if we are doing an all ceramic, porcelain fused metal, or an all metal. We should preserve the pulp and the margin as well, right? And the adjacent teeth. Um, Adequate porcelain should be there, guys. So yes, we do have in the PFM, we have porcelain, we have a opaque layer, right, and a metal framework. So just to hide the opaque layer, now we're kind of masking by the porcelain, the shades of porcelain, guys. That's what you appreciate and see. So we do have many layers, right? And that's why the tooth preparation should be done properly, guys, right? And sufficiently. You can just see an example of a tooth preparation in the maxilla, right? For a metal ceramic restoration, right? You should have two distinct planes, and we have taught you many times and told you many times, right? Example of that. Okay, coming to the last slide, guys. That is this is a poor preparation done. You can see that there are restorations, there are caries, and then there are probably micro leakages. So it has to be again taken care of. The margin are not placed well. In the D, you can see that there are metal collars which are visible. Because of the metal collars, you can see that there it can lead to periodontal diseases, pocket formation, recession, caries. There can be many problems, right? So basically, why I'm showing you this photo is we cannot work like this, guys. We have to have a proper, if you follow proper principles of tooth preparation, our work will not look like this, right? Okay. Thank you so much for patient listening, guys. This is the bibliography. Schillenberg, Tillman, and Rosenstiel remains the same, guys. This is basically from Rosenstiel and Schillenberg. Uh, yeah, thanks, guys. For any further questions, you can come and see me. And yeah, thank you.